So in the next part of troubleshooting, we are not going to look at the ventilator. We are going to look at the ventilator only if necessary. So let me show you the case. So this case is a patient, 72-year-old, who has come with chest pain and severe acute pulmonary edema. And you can see that in the emergency department, there was a suspicion of COVID, but the patient was very breathless, and so he got intubated in the emergency department. And he was ventilated in the pressure control mode. The pressure control mode has been chosen just to demonstrate to you how to use the pressure control. The FiO2 was 0.5 or 50%. The inspiratory pressure was set at 15 above PEEP of 10. Respiratory rate was set at 20. I ratio was set at 1:2. And once this was attached, the patient desaturated to 85%. So now we have to assess and manage this patient. So I'm just going to make these settings on the ventilator. Please bear with me. So let's see, let's choose an FiO2 of 50%. You can see this is the knob which adjusts the FiO2. So I'm going to choose 50% here. Okay. Then the next setting is the inspiratory pressure. So first I'm going to change the mode. To change the mode, what I have to do is I have to change from volume control to, so we have to change from volume control to pressure control. So I have selected it, it's become white. As I turn the knob, you can see that it's come to PCACMV. So that is pressure control now. So I'm going to select that. Then I'm going to place it on standby so that I can make my settings. I'm going to select standby. Okay, so the alarms will go away. Now, let's look at the remainder of the settings. So the respiratory rate is set at 20. The I ratio suggested is 1:2. And the PEEP is suggested 10. So let me make that change. I select PEEP, it becomes white. I make it 10. And then the inspiratory pressure is 15. Okay, so those are the settings that have been given to me. Now, on these settings, what is happening is the patient is desaturating to 85%. So how do you think you're going to manage this scenario? Now, when a patient desaturates on 85%, the next thing to look at is if the pulse and blood pressure are stable. If the pulse and blood pressure are stable, you've got a good plethysmograph. The first thing is, if you're not already on 100% oxygen, you make it 100% on the ventilator. Okay, so I was on 50%, so I'm making it 100%. So this is a safety measure. So once I make it 100%, then I begin to look at the ventilator. Now on the ventilator, if I find this is pressure control, so pressure is not going to go above a particular limit. So in this case, pressure is 15, PEEP is 10. So it's not going to go above 25. So the pressure alarm is not going to go off. So here what is likely to go off is the low minute volume alarm. So if the low minute volume alarm goes off, then I need to find out why the low minute volume alarm has gone off. Okay, so it is possible that, like for the previous case, the tube has either slipped out, in which case the air is leaking, or it has gone into one side, and so for the same pressure, less tidal volume is being delivered, or it could be any of the problems that we discussed with the previous case. So for example, in the airway, there could be tube biting, tube kinking, the tube may have slipped out, the tube may have gone in. It is possible that there is some problem in the lungs. The problem in the lungs could be that there is a collapse or a pneumothorax or a pleural effusion. It is possible, if breath sounds are equal on both sides, that there is bronchospasm crepitations. So suction is in order to clear the, and if removing the secretions, the patient settles down, then you don't need to do anything further. If we find that after suction it does not settle down, then you may need to consider a trial of bronchodilators or diuretics. If after doing all this, you find that the saturation is still low, in patients with COVID-19, you will need to keep in mind the possibility of a pulmonary embolism. And then, of course, for pulmonary embolism, you may need to do further tests in the form of a 2D echo and an ECG. Thank you.